Here's something nobody has ever asked you to do at a doctor's appointment. Tonight, take a look at your ankle. Watch the skin. If you press two fingers into the flesh just above your ankle and pull them away, and the impression they leave behind stays there, not for a second, not for two, but for 30, 40, 60 seconds before your body slowly, lazily fills it back in. That is not normal aging. That is not just the way things are after 60. And almost certainly, nobody has ever sat across from you and told you exactly what's causing it. Here's what you've probably been told instead. Watch your salt. It might be your heart. Let's try a water pill and see how you do. And here's what happens after the water pill. You spend the next 3 months running to the bathroom. Your ankles are still thick by evening. You're exhausted. And at your next appointment, the doctor shrugs and says, well, it's managed. Managed as if the goal was to tolerate the problem more conveniently. What I'm about to show you is the explanation you never received, the actual mechanism behind why your ankles swell, and it has almost nothing to do with your heart, almost nothing to do with salt, and everything to do with a system your body runs silently in the background that nobody in a 15-minute appointment ever has time to explain. Stay with me, because by the time this video is over, you're going to understand your own body at a level most people never get. And you're going to have a 5-minute evening habit that changes what your legs look like when you wake up tomorrow morning. Before we continue, tell me your name and where you're watching from. I read every comment and I'd love to know who I'm helping today. Let me start with something your biology teacher probably skipped. Most people know they have a heart. Most people know they have blood vessels. Arteries carry fresh blood out, veins carry used blood back, and the heart is the pump in the middle. Simple enough. But here's what almost nobody knows. That system is only half the story. Your body runs a second fluid network. It moves constantly. It touches every single cell you have, and it carries something blood vessels cannot carry on their own: cellular waste, excess proteins, debris, and most importantly for this conversation, excess water. That network is called the lymphatic system. And the single most important fact about it, the fact that changes everything once you understand it, is this: it has no pump. Your heart beats 100,000 times a day without you thinking about it. It moves blood automatically, whether you're asleep, whether you're sick, whether you've been sitting for 6 hours. The heart doesn't care. It keeps pumping. Your lymphatic system doesn't work that way. It moves one way and one way only, through muscle contraction. Every time your calf squeezes when you walk, every time your ankle flexes, every time you stand up from a chair, those muscle contractions physically squeeze the lymph vessels and push fluid upward toward the neck, where it re-enters the bloodstream. Stop moving. The system stops. Think of it like a bicycle pump. The pump doesn't do anything on its own. You have to push the handle. Your muscles are the handle. Every step is a pump stroke. Every flex of your ankle is a pump stroke. And every hour you spend sitting completely still is an hour where that pump sits untouched on the garage floor while fluid quietly accumulates in your lower legs like water pooling at the bottom of a bowl. Now here's why this gets dramatically worse after 60. 3 things happen to the lymphatic system as we age, and they happen at the same time. First, the lymph vessels stiffen. Young lymph vessels are flexible and responsive. A brisk walk, and they're moving at full capacity within minutes. After 60, those vessels lose elasticity the same way your skin does, the same way your arteries do. They respond more slowly, they drain less efficiently. Second, the tiny one-way valves inside the lymph vessels start to wear out. These valves are what prevent lymph fluid from draining back downward. When the valves are tight, the system works like a ratchet, forward only. When the valves weaken, fluid can slide backward, undoing whatever progress your muscles manage to make. Third, the connective tissue in your lower legs, the matrix of collagen and elastic fibers that holds everything together, starts to loosen. Fluid leaks into that loosened tissue and sits there like water in a sponge instead of being routed efficiently into the lymph vessels. 3 changes happening together: fluid leaking faster, fluid draining slower, and nowhere solid for it to go. That's the equation your ankles are living inside every single day. Before we go any further, I need to pause here for something important. I want you to think about whether any of the following describe you right now. One leg is swelling significantly more than the other. It started in the last day or two, and the skin is warm to the touch and feels painful. That combination can indicate a deep vein thrombosis, a clot in the deep leg vein. and it is not something to manage at home. That is a same-day call to your doctor or an urgent care visit. Both legs are swelling, and you are also having shortness of breath, especially when you lie flat to sleep. You're waking up at night unable to breathe. You cannot climb a single flight of stairs without stopping to rest. Those symptoms together point to a cardiac issue that has moved beyond the early stages and needs evaluation immediately. You've noticed your urine looking foamy, your swelling has come on quickly over a matter of days or a couple of weeks, and the scale shows you've gained 4 or 5 pounds without any obvious reason. That pattern suggests the kidneys may be losing protein, something that needs blood work this week, not eventually. If you have those symptoms, this video is not your next step. Your doctor is your next step. But if your swelling is gradual, if it's been building slowly over months or years, if it's roughly equal in both legs, if it's clearly worse in the evening and clearly better in the morning after a night of lying flat, and you have no trouble breathing at rest, then you are in the right place. What you most likely have is a lymphatic drainage deficit, and it responds beautifully to the right approach. Not all ankle swelling is the same. There are 3 distinct patterns, and they look almost identical from the outside but have completely different origins. Pattern 1, venous. The veins returning blood from your legs back to your heart are struggling. The valves inside those veins have weakened or failed. Blood pools in the lower leg, pressure builds inside the vessel walls, and water gets pushed through those walls into the surrounding tissue. The telltale signs: visible ropey or knotted veins on the legs, a brownish or rust-colored staining on the skin around the ankle and lower shin, and swelling that gets dramatically worse on days you spend standing for long periods. Pattern 2, lymphatic. This is what we're talking about today, and it's the most common pattern in people over 60 who have no heart or kidney disease. The swelling is soft and puffy. It leaves a pit or indentation when you press it. It often involves the top of the foot, that puffy ridge just behind where your toes meet your foot. And here's the distinguishing marker I'll come back to. In chronic cases, the skin on the top of the foot becomes thickened, almost leathery. You try to pinch it, and you can't. It's adhered to the tissue beneath like it's been glued. That finding alone tells an experienced clinician a great deal. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It lets me know you're watching and getting value from this. Pattern 3, cardiac or renal. The heart is not pumping efficiently enough, or the kidneys are not filtering properly. The swelling here is also bilateral, but it almost never shows up alone. It comes with a package: unusual fatigue that limits what you can do, nighttime urination that's frequent and disruptive, weight gain that appears quickly without a change in eating, and breathlessness with exertion that wasn't there before. If those symptoms are part of your picture, pattern 3 needs a workup, not a YouTube protocol. Many people over 60 with gradual, symmetric evening swelling and no cardiac symptoms fall into pattern 2. And if you do, here's the reassuring news. The lymphatic system is exceptionally responsive to the right kind of targeted physical intervention. It doesn't need a new drug. It needs to be reminded what it's supposed to do. I want to tell you about someone I'll call Margaret. Margaret is 71. She was an accountant for 35 years, sharp, organized, doesn't miss appointments. She had been dealing with ankle swelling for about 3 years when she came in. Both legs symmetric, worse by evening, gone most mornings. Classic. By the time I saw her, she had already been through the cardiac workup. Echocardiogram, normal. Ejection fraction at 58%, well within range. She'd had her kidneys checked, normal. She'd been on a diuretic for 14 months and had cut salt aggressively from her diet. She'd done everything she was told, and every night at 8 p.m., she still couldn't get her rings off. What Margaret noticed, and what she hadn't thought to mention at previous appointments, was this. When her grandchildren visited for a week last summer and she was on her feet constantly, chasing a 3-year-old walking to the park up and down the stairs, her ankles were better than they had been in years. The moment the grandkids left and she went back to her normal routine, the swelling came back within 4 days. That detail, better with sustained movement, worse with sustained sitting, is the lymphatic signature. This isn't a criticism of diuretics. For the right pattern, they're the correct tool. But for lymphatic swelling specifically, the mechanism doesn't match. What Margaret needed wasn't a prescription change. She needed a way to manually activate a system that age and inactivity had allowed to quietly go dormant. And here's the thing about Margaret's situation that I think applies to a lot of you watching this. She wasn't sedentary. She wasn't inactive by most measures. She walked to her mailbox. She cooked. She wasn't someone who never moved, but she was someone who sat for 4 to 6 uninterrupted hours a day, every single day. And those uninterrupted hours were giving her lymphatic system the perfect conditions to fall behind. The lymph system doesn't care about your total daily steps. It cares about whether your calf muscles are contracting frequently enough throughout the day to keep the conveyor belt running. 4 hours of stillness is 4 hours of backup, even if you take a 20-minute walk in the morning. The saboteurs. Let me quickly cover 3 things that actively make lymphatic drainage worse for people in this age group, because if you implement the habits I'm about to teach without addressing these, you will get only a fraction of the results. The first saboteur is sodium you don't see. Salt from a shaker is easy to reduce. But the sodium loading most people in this age group experience doesn't come from the shaker. It comes from bread, from cottage cheese, from canned vegetables, from deli meats, from seasoning packets, from restaurant soups. Sodium draws water out of your bloodstream and into your tissues with chemical precision. Studies suggest your body may retain significant amounts of water. Some estimates suggest several cups for each gram of excess sodium consumed. You may think you've cut salt because you put the shaker away, but if you're eating 2 servings of canned soup a week, you are consuming what amounts to a small salt lick. The second saboteur is evening sitting, specifically the recliner hours, that period from about 7 to 10 p.m. when the day is done and you've finally earned some rest. Those are simultaneously the hours when your legs need movement most and the hours when they get it least. 3 hours of evening inactivity means 3 hours of fluid accumulating in tissues that will then need to reabsorb overnight, disrupting your sleep. We're going to fix this with a timed evening sequence, not by asking you to give up your rest. The third saboteur is alcohol. This one is uncomfortable for some people to hear, but it's important. Research suggests even moderate alcohol consumption can affect overnight fluid redistribution. Alcohol dilates the small capillaries, increasing the rate at which fluid leaks from the vessels into surrounding tissue. It also suppresses the hormone that signals your kidneys to reduce urine production at night. The result, more fluid in your legs going in, and more middle-of-the-night bathroom trips as your body scrambles to deal with the backlog while you're trying to sleep. You don't have to stop drinking, but if your swelling is significant, the data on this is clear enough that it's worth knowing. Before we move on, there's something important I don't want you to miss. If this section made you realize that some of your daily habits might be quietly working against your body, do me a quick favor and hit the like button. It helps this kind of practical, no-nonsense information reach more people who are dealing with swelling and don't even know what's causing it. And I'm genuinely curious, which of these 3 do you think is affecting you the most right now? Hidden sodium, evening sitting, or that nighttime drink? Let me know in the comments. I read every single one and it helps me understand what you're going through. Before the protocol, let's briefly look at what supports lymph flow from the inside out. Water, more than you think. I know this sounds backwards. If my legs are holding water, shouldn't I drink less? No. Dehydration makes lymph thick and sluggish. Well-hydrated lymph is thin, flows freely, and drains efficiently. The goal is roughly half your body weight in fluid ounces spread across the day, but tapering after late afternoon so it doesn't all hit your bladder at midnight. Flavonoid-rich foods. These are compounds found in dark berries, red and purple grapes, citrus pith, and red cabbage. Flavonoids strengthen the walls of your capillaries. They reduce the leak rate from the inside. Less leaking means less for the lymph system to clean up. A cup of mixed dark berries daily is not a dramatic dietary change, but over 6 to 8 weeks it has a measurable effect on capillary integrity. Protein, specifically albumin. This one surprises a lot of people. There is a protein in your blood called albumin, and its job is to hold water inside your blood vessels through osmotic pressure. When albumin is low, which is quietly common in adults over 65 who aren't eating enough protein, water leaks out of your vessels at a higher rate because there's nothing pulling it back. 2 quality protein servings a day eggs, fish, legumes, Greek yogurt. This is one of the simplest and most underutilized tools in managing chronic lower leg swelling. The 5-minute evening protocol. This is the core of the video. Everything up to this point has been building toward this. Pay close attention to the sequence and the timing because both matter. Step 1. The morning wake up, 30 seconds. Before your feet touch the floor tomorrow morning while you are still lying in bed, do 30 ankle pumps. Point your toes away from you, then flex them back hard toward your face. 30 full repetitions. This wakes the lymph system up before gravity gets a chance to pull everything back down into your feet. It takes under a minute. It sets the tone for the entire day's drainage. Step 2. The hourly reset. Every hour you're sitting. Set a timer on your phone for 50 minutes if you need to. When it goes off, stand up and do 20 heel raises. Rise up onto the balls of your feet, pause at the top, come back down. Or if standing is difficult, stay seated and pump your toes upward and down 20 times with your heels on the floor. This keeps the lymph conveyor belt running instead of allowing a full hour of complete stagnation. It takes 30 seconds. The cumulative effect across a full day is significant. Step 3. Pre-dinner walk. 5 minutes. Before your evening meal, not after, before, take a 5-minute walk. Around the block, around the house, doesn't matter. Walking at any pace activates the deep posterior calf muscles in a way that seated exercises cannot replicate. This is the last full-body pump opportunity before you move into the evening winding down phase. Doing it before dinner keeps you from skipping it. Step 4. The evening drain sequence. 15 minutes, 90 minutes before bed. This is the heart of the protocol. Pick a spot on the floor near a wall or lie on your bed near the headboard. Elevate your legs up the wall so that your heels are above your hips and your hips are above your heart. You don't need a perfect right angle. Close is fine. The goal is inversion. Get the fluid going upward with gravity's help for a change instead of fighting it all day. Stay in that position for 15 minutes. During those 15 minutes, minutes 1 through 5, slow ankle circles. 10 rotations clockwise, 10 counterclockwise on each foot. Feel the joint move through its full range. This squeezes the lymph vessels in the ankle and initiates drainage from the distal end up. Minutes 5 through 10, alternating slow ankle flexes. Point and flex, alternating feet at a pace that feels deliberate rather than rushed. This engages the calf. Think of every flex as a squeeze on a pump. Minutes 10 through 15, deep diaphragmatic breathing. Place one hand flat on your belly. Breathe in slowly through your nose, letting your belly rise for a count of 4. Hold for 2. Release slowly through the mouth for 6. Your diaphragm, as it descends on each inhale, physically compresses the thoracic duct, the central lymphatic channel that runs through your chest behind your breastbone. Deep belly breathing is one of the most powerful lymphatic pumps available to you, and almost no one knows it. After 15 minutes, roll to your side, sit up slowly, and do this final step. Starting at your ankle, use the flat of your fingers, not your fingertips, the whole flat surface, and stroke the skin upward toward your knee with gentle but firm pressure, always toward the heart, never downward. 10 long strokes on each leg. This is a simplified manual lymphatic drainage technique. You are physically moving fluid from the saturated tissue into the lymph capillaries where it can be transported upward. It is unglamorous, it takes 2 minutes, and it works. Many people notice the urge to urinate within 30 minutes. That's the fluid your body is beginning to clear on your schedule rather than at 2 a.m. You just moved it on your schedule while you were awake and in control of your night. If this is making sense to you, hit the like button so more people can see this simple routine. And tell me in the comments which step you'll actually try first tonight. I read every comment, especially on this one. The self-assessment. 2 tests you can do right now before the end of this video. Test 1, the pit test. Find the bony ridge of your shin bone about 4 inches above your ankle. Press your thumb in firmly and hold it for a full 15 seconds. Lift your thumb. Watch. If a visible indentation remains and takes more than 10 seconds to fill back in, you have what's called pitting edema. Grade it. Mild is a slight dent that fills in within 30 seconds. Moderate is deeper, lasting a minute or more. Significant is a dent that persists for several minutes. Write down your grade today. Retest in 2 weeks using this protocol. The change will be measurable. Test 2, the stemmer sign. Try to pinch the skin on the top of your foot right behind your second toe, between your thumb and index finger. If the skin lifts into a small fold easily, your lymph is moving reasonably well. If the skin feels flat and immovable, like it's adhered, that is a positive stemmer sign, one of the most reliable clinical indicators of chronic lymphatic congestion. It means the tissue has been saturated long enough for structural changes to begin, and your protocol needs to be consistent over several weeks to see full benefit. 5 things to do tonight. I want to make these as simple as possible. 1. Do the PIT test right now and write down your grade. 2. Identify the one hidden sodium source you eat most frequently this week and swap it out. 3. Before dinner tonight, take a 5-minute walk. Not later, before. 4. 90 minutes before bed, legs up the wall for 15 minutes, ending with 10 upward strokes on each calf. 5. Tomorrow morning, 30 ankle pumps before your feet touch the floor. Do that for 14 days. Retest. Your ankles are not aging badly. They are a drainage system that stopped receiving the signals it needs to do its job. Give it the right signals, consistently at the right time of day, and the response is not subtle. It shows up in the mirror, it shows up in your shoes, it shows up in the first morning you sleep through the night and wake up without pressing your fingers into your own leg to check. Before you go, I want to ask you 2 things in the comments below. First, how long have you been dealing with this? A few months, a few years, longer? Second, has anyone ever explained the lymphatic system to you before today? I genuinely want to know, and if someone you care about has been told their swelling is their heart and they've been handed a water pill that doesn't quite do the job, send them this video. You may give them the explanation nobody sat down to give them. I'm Dr. Franklin. I'll see you in the next one.